Hi guys, this is Zach here from Body Comp Online. Thank you for everyone for getting back to me on the post I did yesterday in regards to the foam roller. Now, because there were so many issues that everyone posted, I've decided to do like a 4-part series of how to use the foam roller. Now, the most common issue that everyone was coming up with was like hip pain, knee pain, and lower back pain. So the video I want to do today is how to release muscles around the hip to help with these issues. So there's 4 or 5 major muscles that we want to hit in the foam roller to help with these pains that everyone's suffering from. So first of all, make sure you got a foam roller. Now, the muscles that we want to target when using the foam roller is 1, the TFL, 2, the ITB, 3, the quad, 4, the glute, and 5, the lower back. Now I'm going to do them in a sequence, and I want you to follow the same. If you do them daily, it should really help with your issues with these areas. So first of all, we're going to target the TFL, and then roll it into the ITB. Now, when we are doing these, it's not going to be nice basically. So what we're going to do, foam roller, we're going to place the body weight on the foam roller, right just above the hip joint. We're going to use this leg as a support leg, and my elbow as the support arm, and we're going to use this as like a pain tolerance tool. Now what you want to do, you want to find what we call hot spots, or pressure points or trigger points, depending on what you want to call them. And we're going to find them, and then we're going to roll over them nice and gently. Now if you can handle more weight, you can put your leg on the top. I'm going to roll over them points until they release. Then I'm going to roll onto the IT band, and again I'm going to use this leg and this arm as support, and I'm going to slowly look down my quad, on the side of my quad, all the way to the knee. Keep breaking down that tissue on the side of the leg. Now this will reduce knee pain, especially for the ones who are doing a lot of running. You'll find you get a pain on the outside of the knee joint. It's normally due to the pain and the tightness in the IT band. So we're going to work all the way into that quad, looking all the way up and down. Now this will be uncomfortable, so you want to use that leg and that arm to take off the pressure or add more pressure on. Now once we've done the IT band and the TFL, we'll move on to the quad. I'm going to use it on this leg for this example. Now I'm going to start at the bottom of the leg this time, and I'm going to roll the major muscle up towards the hip. So again, you can use your arms as support, and if you need extra pressure you can add an extra leg on. I'm going to roll up, down the quad, breaking down all the adhesions along the way, all the way into the hip flexor. Yep. Now once we've done these, the first 3, next we're going to go on to the glute. So I'm going to show you from the side on this one. So first of all I'm going to sit on it, we're going to roll my left glute. Right leg's going to be there. And bring my left leg over, opening up the hip at the back. Then I'm going to start right at the top of the glute, which is just below your lower back. And again, we're just going to roll it. Then I'm going to move it over just a tiny bit, just on an angle. Then I'm going to get in the side as well. And just like the IT band, the TFL and the quad, you're just looking for them trigger points. And when you're on one, you start to break them down. There we go. Now, obviously you're going to do both sides as well. And to finish with, we're going to move on to the lower back. Now, first what I'm going to do, I'm going to roll the spine evenly. So I'm going to brace my abs, so obviously I'm going to round over it. I'm going to put pressure on the lower back, and I'm going to gently just move up and down the spine, up to around the mid-back, up and down. After a few rolls, I'm going to lean slightly to one side. I'm going to put more pressure on the left spine, or left of the spine should I say. And then I'm going to do the same on the right side as well. They're the main 5 I want you to do. Now, when we are doing foam rolling, obviously if you've got an issue with the left side, always start with the side with the issue, but always equal it up on the other side. Now, if you would like to know more on why we pick these muscles and why they'll help hip pain, knee pain and lower back pain, hit comment and like, and I'll release another video on why we do them particular muscles. Cheers guys.